I think Foundry is so unique because never in my experience of receiving healthcare services before it existed did I ever feel like I had a voice.
Youth and family and caregivers, when they are designing, co-creating services that they'll be using, they're so much better. They're going to be designed in a way that youth are actually going to want to use those services.
A lot of the time we see the word engagement thrown on things that is really inauthentic. You know, we're asking you for your opinion, but we're actually not really going to take it and we're not going to do anything with it. But for me, in a Foundry context, engagement has looked like being a member of a youth action committee and a youth advisory council and being a part of, okay, we're changing up branding and we need, you guys to tell us what you want to see. Like, what's going to make you comfortable when you come to this space.
One time that Foundry really sought my experience as a young person and really my opinion on something was during convening. That was when we chose new communities for centers to be in. That felt like a very large decision, thinking about how much money goes into each center, how much support goes into each center, to be able to look through their applications, to talk with the communities and feel very heard.
A lot of the time, Foundry reaches out to us for really important decisions that sometimes you would imagine, in any other organization, would be solely at the executive level. But with Foundry, we get to be a part of everything.
I think engagement is an oversimplification of what we're doing. I view it as a partnership. Engagement, I think, leads to empowerment and advocacy. So if you do engagement properly, what you should start to see, right, are young people not only leading the direction of Foundry, but you see young people working in our centers.
There's 7 key engagement principles that Foundry uses to embed within our organization to make sure that young people, families, and caregivers are respected and seen and heard within our organization.
The idea behind our practice principles is really to ensure that we're going beyond just listening for opinions. By having these principles in place, we are committing to a far richer relationship. That's our commitment to young people, is to say, we're in this with you. We're only going to do this if you're here with us and telling us that this is the right thing to do. Let's work at building this relationship out. And there have been times when that relationship has broken down. And when that relationship has broken down, it's because I think some of those principles haven't been adhered to. And our job at Foundry Central Office is to support the partnerships to get back on track.
We don't just bring all of the centers together and talk to them about how this is how you do engagement. We go to them and we say, tell me what it looks like in your community. Tell me what engagement looks like from your perspective, and how can I help you and support that, right? So less of that top-down approach.
You really need to, I think, reflect on what is being said and heard, even when it may not be what you want to hear or thought young people would say. And I think that there have been multiple occasions over the years where our services have been made a lot better because that we listened to young people and heard their opinions.
Well, we know that parents and caregivers and support people in a youth's life are very important influences for them. We know that through research, and we know that through the stats that Foundry collects, especially when answering questions like, where would you have gone if Foundry didn't exist? Or how did you hear about Foundry? Families are always near the top of that list. And so we know that that circle of care and that holistic approach is what youth and families need in order to not just survive, but thrive.
What's happened, I think, in the last 20 to 30 years in mental health and child and youth mental health is that we really, really have not invested in the importance of parents. Foundry is about transforming access to care. That's what we're trying to do. Trying to make the world a better place for our kids, right? I think by doing that, we make the world a better place, full stop. But along the way, in order to make the world a better place for our kids, we have to make the world a better place for our parents too.
If I've lost my breath and I can't breathe, how do I breathe life into my child? And how do I have that strength to provide for them if I'm running on empty myself? The family health is important, and when one suffers, that ripples down throughout, and there's repercussions to that.
There was no help for family members, and there was no way that they could either get trained or have a counselor work with them so that they would be better suited to support their young people. And when we heard that, we started to really think about what were some of the therapies or what were some of the interventions that we could provide for folks in our network that would allow them to support family members.
Foundry sought my input on a number of different things, and it's been really valuable to then see that those opinions be taken seriously and things be readjusted or shifted or changed in the way that makes it comfortable and more relatable.
So in terms of partnership with families, there are many different avenues, particularly through the local center or at the provincial level. In the local Foundry centers, family can be involved in what's called a family advisory committee. And there they work alongside the Foundry staff and lend their voice and their lived experience into every decision that is made. And the same thing happens at the provincial level, where there are opportunities through the Provincial Family Ambassador Program and the Provincial Family Representatives Program.
As I look at this room, what really excites me is that this is really a nice beginning in terms of the kind of movement we can see in BC, the kind of movement we can see created by our youth and our families.
So I do a lot of things with Foundry. I'm part of basically every single working group there is. The biggest thing that Foundry does is they make a lot of space for your own capacities when it comes to how you want to participate. We're all people with lived experiences, so you have to understand that, you know, some days people can't have the same capacity they do other days.
Foundry has a number of different youth advisory committees where young people come together and co-create and co-design services. They also impact things like our communications plans, to our walk-in counseling, to what we post on social media, and also our anti-racism initiatives, and show us the path and the journey towards anti-racism. Indigenous-specific racism is really embedded within our healthcare system. We really need to take that into account and to make sure that Indigenous youth and families and caregivers feel safe accessing the services within our communities.
Work that myself, my colleagues are working on really supports looking at Indigenous wellness across the Foundry initiative. So we know we need to build trust. We need to build trust with Indigenous young people, families, and communities, and this is new space for us. So we've been working alongside partners like First Nations Health Authority and some of the youth structures that they already have to be able to connect in with Indigenous young peoples and communities to hear and to learn more. You know, we've heard really strongly, especially from young people in this last year, that racism matters and that, you know, Foundry has a place to both disrupt and hopefully dismantle racism as we go along.
I lived through a lot of trauma, and it would be sad to see anybody else to go through that trauma. And I'm glad people reach out or come to Foundry to find the support they need. Some people have challenges in their lives, and I'm honored to share my challenge as a youth and my experience as an elder. And I have been here maybe 4 years now and sharing our cultural experience in the way of cedar bracelets and cedar roses and Devil's Club. Every month I bring in 10 to 12 kits to share with the youth how to make different cedar pieces and or Devil's Club. These are all Devil's Club necklaces. They choose whatever they'd like to use. But then they have the cultural experience when people prepared for a potlatch and they would make baskets for 300 to 600 people. Their whole family would be involved in making that. I feel the biggest struggles our youth have is not knowing where they come from, losing family connections because of a job, because you move from northern BC down to Vancouver, a city that's a totally new environment. So youth have a difficult time with change.
Where we come from is such a strength of who we are. I'm Stalo and I'm Crease, and my grandmother came over from Alberta. She was in Stony Plain, Alberta, and her and her brother and her siblings went to residential school. But, you know, obviously a lot of that tradition was lost.
I've definitely been discriminated against in my younger years, and so is my mom, and that's really given me the passion to bring forward and work within the healthcare system, seeing my mom as someone who has a disability and chronic illnesses, accessing services and being discriminated against. I wanted to do something about that.
People with lived experience are often in a great position to make change because they know what it's like to be in that place, and they also often know what it's like to be resilient through difficult experiences, and so they can kind of tell you what it looks like on the other side.
You're really getting that authentic voice that you can't fake. Like, you can't fake having lived experience. People see through it.
I'm just honored to be part of Foundry because I make a difference in my way. I feel rewarded because I hear from the youth. They say, thank you for coming in, or gee, thank you for sharing, because I know I've made a difference in their life for that moment. If I shared some words that might have shifted their thinking about themselves, about ideas in their life, I know they have done that for me.
Foundry has affected my day-to-day life in the sense that before I became a youth advisory council and committee member with Foundry, it was really hard for me to find ways to feel passionate about things and ways to feel like I was making any sort of measurable change. Coming to the Foundry Center and meeting all these other youth of different ages, like people who were way younger than me or people who were way older than me, and I was able to talk to them about everything. And I developed relationships with people that worked here and accessed a lot of the services here as well. And it just gave me so much hope.
Seeing that progression from someone who's accessing services to being on the advisory, and then in some cases seeing those young people then go on to university or college to then, you know, get educated so that they can come back as service providers themselves. I think that kind of growth has been really cool to watch.
I'm working with the Ministry of Health in kind of data access, and then I'm also still a student, so I'm doing my Master's of Health Administration at UBC so that I can make an even bigger impact on our health system and propel organizations like Foundry forward and have their model be more widespread.
I think when we look to the future of Foundry, what we're really wanting and hoping to see are layers and layers of opportunities for young people to work alongside us, so that whenever decisions are made, whenever any kind of course correction occurs, young people are leading that to help really guide us and to lead us in the work that we're doing and the work that's to come.